In this video, I'm going to show you a demonstration of the setback dermal technique that has grown to be my favorite workhorse technique, and I learned it from Dr. Jonathan Kantor. When it comes to deep suture techniques, this is what I typically use for our most patients and also for my excisions. I've truly found a significant difference in how our patients heal post-operatively. It helps create this beautiful wound edge eversion, and it's evident when patients come back months after surgery with minimal scarring. It's different from the standard vertical mattress and simple bury technique that we're taught in that there's no suture material in the incised wound edge. So I see less issues with suture reaction and spitting sutures in our patients. So to proceed with the demonstration, I am going to use 5/0 Vicryl with a large needle, and we are utilizing pigskin to define the incised wound edge to get a better visual. So this is the incised wound edge, and you want this clean and clear and debeveled, and that is what's going to make the biggest difference in how the patients heal. You don't want any suture material or anything inside the incised wound edge, okay? So what we're going to do is we're going to reflect back that skin nice and gently, and you want to make sure you get a nice, beautiful visual of the underside of the dermis, okay? So once you reflect back nice and gently, you want to take your needle and you want to be about 2 to 6 millimeters away from the incised wound edge. Here's the wound edge. You want to be 2 to 6 millimeters away, and you want to enter perpendicular to the skin. And as you enter, push through using the curvature of the needle, and you want to not exit through the inside wound edge, but you're in the underside of the wound edge about 1 to 4 millimeters away, okay? And then what I want you to do is I want you to release, and I want you to look back just to make sure you're not causing any epidermal dimpling. If you see any dimpling here, that means you took too thick of a bite, so I want you to try again, okay? So just to see in one motion, we're going to reflect gently with the incised wound edge, enter about 2 to 6 millimeters away, go perpendicular, follow the curvature of the needle, and exit about 1 to 4 millimeters away from the incised wound edge. You want to take your needle driver and push through, no epidermal dimpling, and then you can have your forceps help you pass that needle through, and just be careful not to damage that tip, okay? Reload your needle, and sometimes what I do is I take my suture and I use it as a guide where we're going to mirror and enter on the other side. So essentially what you're going to do is you're going to do the same technique on the other side. Let's reflect back, visualize beautifully the underside of the dermis. And here is your incised wound edge, so you want to be about 1 to 4 millimeters away, and then enter perpendicular through the skin, through the dermis. Make sure you're not causing any epidermal dimpling. And as you enter, you're going to exit about 2 to 6 millimeters away from the incised wound edge. Again, mirroring the other side. Take your forceps, pull through, and make sure your tails are on the same side. And I like to practice. I go back and forth to see how my suture is doing and how the wound is approximating, and we look good. All right. Again, if you don't look good, you just gotta try again. Perfection is key, guys. So what you're gonna do is you're gonna take your long suture and take your needle driver, create 2 loops around your needle driver, cinch that knot down, place your needle driver parallel to the incised wound edge, do 1 loop this time, tie it in the opposite direction, place your needle driver parallel to the incised wound edge, 1 last loop around, and tie 1 more knot. Typically 3 knots will suffice. And as you are cinching your knot down, you are looking to see how well your wound is approximating and everting. So that's the wound eversion that you're looking for. Nice and beautiful. You let go of the suture. And then what I like to do is I like to take my sutures, write it down until I feel the knot, and just cut it right above the knot. And that is the wound eversion that you're looking for from the setback dermal technique.